Are you making the 7 mistakes that hold medical trainees back? Stick around. By the end of this video, you'll know exactly what they are and how to avoid them. Welcome to Study Neuro, your hub for practical tips on thriving in medical training and beyond. Today's video is titled, From Average to Outstanding: 7 Mistakes that Hold Medical Trainees Back. Clinical rotations are one of the most exciting milestones in medical school. For the first time, you step out of lecture halls and into the real world of medicine, the wards, the busy clinics, and sometimes even the operating theater. This is where theory meets practice, where those textbook conditions you've memorized finally have a face, a voice, and a story. It's the moment you begin that transformation from student to doctor. But let's be real. Clinical rotations can also feel overwhelming. You're surrounded by experienced doctors, nurses, and other healthcare professionals who seem to know exactly what to do, while you're still figuring out where to stand, what to say, or how not to get in the way. Here's the truth. Standing out on rotations isn't about being the smartest in the room. It's about avoiding small, common mistakes, the habits and oversights that quietly hold trainees back. And that's exactly what we're diving into today. I'll walk you through the 7 biggest mistakes medical trainees make on clinical rotations, and, more importantly, how to avoid them. By the end, you'll have a clear roadmap to not just survive rotations, but to stand out as a confident, capable, and compassionate future doctor.
Mistake 1: coming unprepared. One of the most common mistakes trainees make on clinical rotations is simply coming unprepared. And this shows up in 2 main ways. First, arriving without reviewing patients or the day's cases. Imagine standing on a ward round. The consultant turns to you and asks, "What's the main problem with this patient?" And you have no idea because you didn't look at the case notes the night before. You immediately lose credibility, and worse, you miss the chance to really learn from that case. Second, it's the basics. Forgetting simple but essential examination tools, for example, stethoscope, a notebook, or even a pen. These may seem minor, but they send a strong message. To your team, it looks like you're not taking the rotation seriously. And practically, it makes you dependent on others, borrowing equipment when you should be contributing. How to avoid this? It doesn't take hours of preparation. Just 15 to 20 minutes the night before makes a huge difference. Skim through the patient's case note, refresh yourself on their main diagnoses, and check what procedures are scheduled for the next day. This way, when something comes up on rounds or in theater, you can actually follow what's happening, or even answer when asked. And don't forget your toolkit: stethoscope, notebook, pen torch, etc. These small items are your badge of readiness. They tell the team, "I'm here, I'm serious, and I'm prepared to learn." Remember, being prepared isn't about knowing everything. It's about showing up ready to engage, contribute, and learn.
The second mistake I see all the time is weak case presentation skills. Now here's the reality. Clinical rotations aren't just about what you know. They're about how you communicate what you know. And too often, trainees stumble here. Presentations that are disorganized, too long, or missing key details frustrate supervisors. It slows down ward rounds, makes you look unprepared, and worst of all, it cuts down your learning opportunities. Another part of this mistake is passivity. If you always stand at the back and never volunteer to present, you'll quickly become invisible. And when you're invisible, you're forgettable. How to avoid this? The key is structure. Stick to a simple, clear framework every time. Biodata, chief complaint, history of presenting complaint, relevant past medical, surgical, and social history, exam findings, diagnosis, and plan. If you follow this consistently, you'll sound organized and professional, even if you're still learning the finer details. And remember, presentation is a skill, not a talent. You get better with practice. So rehearse out loud, even to yourself before rounds. Volunteer whenever you get the chance. The more you present, the more confident and polished you'll become. Good case presentation doesn't just make you look competent, it makes the whole team's job easier. And trust me, consultants notice when a trainee can present clearly and concisely. The third mistake that really holds trainees back is neglecting professionalism and engagement. Now, professionalism might sound obvious, but it's often the small habits that give the wrong impression. Things like showing up late, being glued to your phone when you are with the team, standing with poor posture during rounds, or interrupting seniors. All of these send a signal that you're not taking the rotation seriously. And once your supervisors feel you lack respect, it's very hard to rebuild that trust. Another subtle mistake is asking questions at the wrong time. Curiosity is great, but firing off random questions in the middle of a busy ward round frustrates the team. It comes across as tone-deaf rather than engaged. How to avoid this? Be punctual. Arrive before your team, not after them. It shows reliability. Be attentive, maintain eye contact, stand confidently, and listen actively. Body language matters. Be smart with questions. Write them down and save them for a teaching moment or after the round. That way, you still show interest without disrupting workflow. And most importantly, respect everyone. Doctors, nurses, physiotherapists, even health assistants. Rotations work because of teamwork. How you treat every member of the team says more about you than any exam grade. Professionalism and engagement are not about being perfect. They're about showing maturity, respect, and eagerness to learn. If you consistently demonstrate that, you'll quickly stand out as someone the team wants to teach and trust.
The fourth mistake many trainees make is overemphasizing theory at the expense of practice. Medical school teaches us to rely heavily on textbooks, lecture notes, and exam preparation. But when you step into the ward, you quickly realize that patients rarely present exactly as the textbook describes. If you stay locked in the mindset of memorizing lists, you'll miss out on the most important part of your rotation, learning how to apply knowledge in real clinical settings. Here's an example. Can you comfort an anxious patient while taking their history? Can you adapt your management plan to what's available in your hospital? These are skills no textbook can fully teach you. How to avoid this? Balance book and bedside. Yes, read about conditions, but spend equal time practicing examinations, clerking patients, and observing procedures. Use daily reflection. After each round, ask yourself, what did I see today that I couldn't have learned just by reading? That simple habit reinforces practical wisdom. Engage with patients. Talk to them, not just about them. Their stories, symptoms, and experiences will deepen your understanding far beyond theory. Ultimately, theory gives you the foundation, but practice is what turns knowledge into competence. The best trainees are those who can bridge both, grounded in science, but confident at the bedside.
The fifth mistake is ignoring the human side of medicine. It's easy, especially during busy rotations, to slip into treating patients as tasks or case studies. You rush into the ward, flip through notes, examine without asking, or discuss a patient as the appendicitis in bed 5. But when we do this, we forget that every case is also a person, anxious, vulnerable, and trusting us with their care. For patients, small details make a huge difference. A trainee who doesn't greet them, explain what they're doing, or ask for consent can make them feel invisible and disrespected. That anxiety not only undermines trust, but it also makes your job harder. A patient who feels ignored is less likely to cooperate, share details, or engage honestly. How to avoid this? Start with respect. Always introduce yourself, state your role, and ask permission before examining or taking a history. Explain as you go. Simple phrases like, "I'm listening to your chest to check your breathing," reduce anxiety and build trust. Acknowledge them as people. Use their name,
make eye contact, and thank them afterwards. These small courtesies humanize the encounter. Show empathy. Remember, what's routine for you may be life-changing for them. Ultimately, clinical rotations aren't just about learning medicine. They're also about learning humanity. The best clinicians are remembered not only for their knowledge, but for how they made patients feel.
The sixth mistake is neglecting the rest of the healthcare team. Many trainees focus only on the doctors during rotations, following consultants on rounds, paying attention only to surgical steps, or waiting for teaching moments from senior registrars. But medicine is never a one-person show. Patients don't just get better because of the doctor. Recovery depends on a whole team. Nurses notice subtle changes in a patient's condition long before anyone else. Physiotherapists help patients regain independence. Pharmacists ensure the right drugs are given safely. Radiographers, occupational therapists, dietitians all play critical roles. Ignoring them means missing out on huge learning opportunities, and more importantly, failing to understand how care really works in practice. How to avoid this? Observe the whole team. Watch how nurses manage wound care or medications, how physiotherapists mobilize a post-op patient, or how pharmacists adjust drug doses. Participate where appropriate. Within your scope, ask if you can assist, maybe with simple nursing tasks, physiotherapy exercises, or counseling under supervision. Show respect and curiosity. Ask allied staff what they look for, how they make decisions, and what challenges they face. By valuing every professional, you gain a deeper appreciation for team-based care. And when you become a doctor, that respect translates into better collaboration, better communication, and ultimately, better patient outcomes.
The final mistake, and one of the most damaging, is not asking for feedback and not following up on patients. Here's the problem. Without feedback, you don't know what you're doing well and where you're going wrong. You may be making the same mistakes over and over, blind to them because no one pointed them out. Supervisors aren't mind readers. They won't always volunteer feedback unless you ask. And when it comes to patients, seeing someone only once robs you of one of the most valuable lessons in medicine: how diseases evolve, how treatments work, and what recovery or complications actually look like. Reading about disease progression in a textbook is one thing. Watching it unfold at the bedside is what turns theory into real clinical understanding. How to avoid this? Be proactive. Ask your supervisor simple, focused questions like, "What's one thing I could improve on for tomorrow?" You'll be surprised how much you learn from even a quick 30-second answer. Revisit patients you clerked. Greet them, ask how they're feeling, and compare today's findings with yesterday's. You'll start to notice subtle changes that deepen your clinical insight. By seeking feedback and following up on patients, you send a clear message. You're serious about learning, you care about your growth, and you value patient outcomes, not just single encounters. That mindset is what transforms you from a passive trainee into a reflective, growing clinician.
So, those are the 7 most common mistakes trainees make during clinical rotations, and more importantly, how to avoid them. Remember, rotations aren't just about ticking off attendance or shadowing doctors. They're about showing up prepared, engaging professionally, and building real human connections with patients and the healthcare team. When you avoid these pitfalls, you don't just make a good impression on your seniors, you start shaping yourself into a confident, competent, and compassionate doctor in the making. If you found this video helpful, make sure you subscribe to Study Neuro for more practical tips on thriving in medical training and beyond. We drop new content regularly to help you sharpen your clinical skills, grow your confidence, and step into your future role with clarity. And I'd love to hear from you.
Drop a comment below. Which of these mistakes have you noticed on your rotations? Or, be honest, which ones have you caught yourself making? Sharing your experience not only helps you reflect, but also helps others who might be going through the same challenges. Thanks for watching. Stay curious, keep learning, and I'll see you in the next one.